All right, Mr. Smith, I need to know some background information about your medical history. Do you have heart disease?
No, sir.
I do not. Have you ever had a stroke? No. Do you have high blood pressure?
No.
Any surgeries?
Nope.
Have you been sick at all?
Nope.
Okay. Well, that's very good. So you have no chronic illnesses?
No, sir.
Absolutely not. Do you take any medicines?
Yes, sir. I take insulin.
So what's that for?
You should know it's for diabetes.
Okay, so that skit had absolutely nothing to do with the topic that we're going to talk about today, which is please, don't lance your own boils. Most people think that if they have a big, pussy, gross nastiness on their leg, they can just take a knife and stab it in there and get all the pus out. That couldn't be further from the truth. Now, there is this thing amongst medical providers, PAs, nurse practitioners, doctors, medical students particularly, I'm not sure what that deal is, where they love, and when I say love, I mean they love a big, juicy, smelly, pussy, gooey volcano of nastiness in people's skin. They love it. Someone comes on the schedule with a, I guess we'll call it a boil. Most people think it's a spider bite. Let's talk about that first. They think they have a spider bite, but the truth is, you had an infected hair follicle, most likely. That filled up with pus. It got infected. Now it's all red and swollen, so they come to the doctor to have it checked out. Most medical students will rush to that, and they cannot wait. They wake up every morning, they hop out of bed, and they say, how many boils can I pop today? I'm not one of those people. Now listen, I won't run away from a boil. There's never been a boil that I won't lance, but I can tell you with certainty that it is not my favorite thing to do. So with that said, let's talk about what an abscess is, a superficial infection, what you should do, what you shouldn't do, and when it's time to go see a doctor. Now, I won't back down from a boil. I will not turn away from one. I will not refuse a patient when they have a big pustule that needs to be popped. But I refuse to enjoy it. I won't do it. Not like my twisted colleagues. Superficial abscesses, or boils as they're more commonly known, is one of the most common things that we see in primary care. Most likely the culprit is an infected hair follicle that is filled with pus and oils, and the body has mounted what we call an inflammatory response. People are really embarrassed by boils, probably because they're gross. I mean, it could be argued that the human body in general is really gross, and the fact that you're an owner of one by default makes you a gross person. So the first thing about these, and the reason why people come in, is that they hurt a ton. And they hurt because of inflammation. Inflammation sucks. I mean, it hurts bad. It causes all sorts of issues. But believe it or not, without inflammation, we would have been dead thousands of years ago. On a side note, modern diets and lifestyles have caused a host of inflammatory responses. We'll call it chronic systemic inflammation, and it's causing all sorts of havoc in our body. I'm not really going to get into that during this episode, but we will in a future episode. So early stages of an abscess is usually just a red, maybe purplish hot spot on your skin. You may even have a little tiny, what looks like a zit right in the center of it. Eventually, most of these superficial infections will do something called loculation. And what that means is all the white cells that travel to the area will develop little tiny pus pockets, almost like a pus-filled Swiss cheese. Now, this early stage of the infection is where most patients get themselves into trouble. They see a pustule, they see the redness, and they think, oh, I can heat up a sewing needle, jab it into my leg, and release the pus and everything's a-okay. Okay, folks, so let's show you what I mean by loculation. So this plastic is your skin, and these little colored putties under here are the pus. But you can't see this. All you can see is an inflamed boil. So you take your needle, you heat it up, and you jam it in there, and then you squeeze and squeeze, and look what happens. Oh yeah, you get a good amount of goop out of there, and now you think you've treated your wound, but really you've got two other pockets here of pus and bacteria that are still festering. Secondly, by pushing and putting all that pressure on that little wound hole you made, you actually run the risk of pushing this stuff deeper and deeper into your tissues. Bacteria go further into your body and could possibly go into your bloodstream. An infection in your bloodstream is what we call septicemia, and that's really, really dangerous. So the next stage of an abscess is when all those little loculated Swiss cheese pus pockets all combine together and make one large pus pocket. Ideally, this is the stage that I want to see you at, because that's when I can actually sterilize the area, use a sterile instrument, make a small incision, and remove that dead necrotic pussy tissue. Then that's it. For the most part, that's all you need. A scalpel, a quick release of all that stored up pus, and you're good to go. Sometimes that pus has left a really, really deep pocket in your tissue, and when we remove it all and irrigate it out with some saline, it leaves a big hole in your body. That's a whole other situation, because what we have to do there is take sterile gauze and pack the wound. By packing the wound, we're filling in this cavity and allowing the wound to heal slowly from the inside out. Otherwise, if we just let you go on your way, the wound can close up and now you've got a pocket, an open sore in your body that will slowly gather pus and blood and will have to be drained all over again. So that's it, folks. If you have a boil, do yourself a favor and don't try to lance it yourself. If you're a medical provider that loves to pop these things, that's just kind of gross. That's it for this week. I'm PA Sully and you're watching Better Off Med.
Set the place on fire.